The administration of contrast is obviously a critical component to the dynamic breast MRI exam. It is critical that an adequate IV be established for this portion of the exam and that the IV site is closely monitored to assure a complete bolus administration of contrast. If IV access is somewhat difficult, this site is tested by bolusing saline prior to connecting the IV to the power injector. Administration of a complete bolus can be critical in the subsequent enhancement characteristics and kinetic curves of the breast tissue. Our technologists therefore routinely will inspect the injection site, and if there is any question on the basis of this inspection, or if complaints by the patient indicates that there may have been a partial infiltration of the bolus, the site of the bolus is imaged to assess for extravasated contrast. This must be noted for the interpreting radiologists so they can bear in mind the possibility that the curves may be diminished due to an incomplete bolus. We administer contrast at a volume equal to 0.1 millimole of gadolinium per kilogram of the patient. This obviously requires weighing of all patients prior to the exam. We do not accept the patient's stated weight. The gadolinium bolus is followed by a saline flush of 20 cc's if the IV site is in the antecubital region and 30 cc's if more distally in the hand. The injection rate of both the gadolinium and saline is 3 cc's per second. The initial post-contrast MRI acquisition should begin 30 seconds following initiation of the contrast bolus when administered in an antecubital site, and 40 seconds following the initiation of contrast administration if it is administered more distally in the hand. This too should be meticulously adhered to. You do not want to have your technologist become distracted by talking to coworkers or involved in other issues during this time, as varying the timing of scanning can have a significant impact on the appearance of your curves and peak enhancements. Again, if for any unavoidable reason there was some alteration in the standard delays in scanning initiation, the technologist should definitely notify you of the situation. You will need to evaluate the study and ascertain whether it will be necessary to repeat the dynamic phase of the study.